With flu season right around the corner, now is the time to prepare. Dr. Theodore Bailey is the chief of GBMC's Division of Infectious Diseases and part of the GBMC Health Partners. Thank you so much for being with us. So I want to ask you, sometimes it is hard to tell if someone actually has the flu or if they're just sort of like sick and run down. What exactly are the symptoms that we should be looking for? Well, the symptoms of flu, which is a respiratory illness, a respiratory viral illness, are cough, congestion, sneezing, high fevers, also chills, and muscle aches. I think the thing that distinguishes it more from colds and other viruses is real severe muscle aches.
That muscle ache.
But you can also get GI symptoms with it, some vomiting, some diarrhea. And one of the ways you can tell is not symptoms, but we do have rapid testing for the flu.
Okay, so the rapid testing, before we even get to the testing, how can we prevent this? I mean, just from even getting it.
Well, and that's the most important thing.
Yeah.
Because once it goes, there's a whole series of things that can happen to a person. But we have two ways to prevent it, and the most effective and I think most important would be vaccination. It is a virus against which we do have vaccinations, and it's around this time of year where each year's new vaccine crop will come up.
So you want to make sure they get that. And I know that there's segments of the population that is really important for them to get it, but everyone really should.
Everyone should get it, children to adults. And it's most important because the people who are going to get the most severe form of the flu are people with other chronic illnesses or people whose immune systems are deficient, and also pregnant women.
I think that makes sense because I didn't even think to take the flu shot until I was pregnant. And then they said, okay, you have to. And then you have the child. So then the child has to get the flu shot. And they're like, okay, well, I might as well. But I feel like there are a lot of adults that just sort of let it go to the wayside because they figure, it's not that big of a deal. But it does spread. So how does the flu actually spread?
Well, as a respiratory virus, it's spread, not surprisingly, by cough. It's by droplets that are expelled. It can be with sneezing, even with talking, with coughing, and it can spread outward approximately 4 feet from a person. It's highly contagious, and we do see millions of cases per year.
And how long is someone contagious?
Well, they're contagious for approximately 1 week, and they're contagious even 1 day sometimes before they have any symptoms at all. And then they're contagious for about a week after the onset of symptoms.
And so you said it is infectious or non-infectious. How does it work for if you are someone that is has an immune system that is impacted or already impaired? Thank you.
So it is an infectious disease, which means it is transmitted from one person to another person.
Okay.
And sometimes it's directly droplets from one person to the next person, but those droplets can also land on surfaces, be picked up on hands, make touch, with your nose or your mouth, and then you may have it as well.
And so in making sure that you are just keeping yourself and your environment safe, do you recommend that people are using like just washing their hands or antibacterial soap, or what can we do to like get rid of the germs around us?
The alcohol-based antiseptic, rinses that you can have in little tiny bottles that you can carry with you are very effective. One of the reasons why the flu needs that droplet is it needs moisture, and these things dry it out, and so they're very effective at cleaning up yourself. But again, you may have breathed it straight in. So vaccination is important.
So how many people get sick with the flu annually? This is a big pervasive problem.
It is a huge problem. The CDC keeps stats on this, and it keeps it over the last 10 years. And we see approximately, I would say, 30 million symptomatic cases, of which about 14 million lead to medical encounters. And we see about 500,000 hospitalizations a year in the U.S. For flu and flu complications, and sadly we see about 50,000 deaths from flu or flu-related complications every year.
So if you are experiencing some of these symptoms, you mentioned it before, there's rapid testing, so you can go in and get this testing done right away to confirm if you have it.
So the testing comes back in about 15 minutes. It can be done in ERs, urgent cares, primary care doctor offices, infectious disease offices.
Yes.
If it's positive, it's highly reliable. There can be some misses, though, so sometimes we get what we call a false negative. So if the symptoms are really well aligned, and it's flu season, the doctor and the patient should both be suspicious that this might still be flu.
And you might have to come back. Dr. Theodore Bailey, thank you so much for being a part of this GBMC Day of Answers about the flu. And you join us on Facebook at 10 a.m. and 3 p.m. and also on Facebook or on our website and GBMC's Facebook page as well, on both. Thank you so much, and we'll be right back with more Midday Maryland right after this. Stay tuned.